This worldwide. I mean, we're seeing it in other countries, not just in Southeast Asia, especially countries that have done well handling, mitigating, and managing the COVID-19 pandemic. So in Thailand, for example, the interesting trend is that the prejudice and the bigotry, well, not so much the bigotry, the prejudice and bias is more against the Europeans. If you were from Europe and you look like a Caucasian, you try to hail a cab, they might ask you where you come from. And there's a perception, I think, partly peddled by the officials, early on that this came from the Italian virus, for example. This is part of the narrative back then in March, April. But the negative perceptions towards the ASEAN neighbors has not been prevalent in Thailand. Not been prevalent. It's more towards against the Westerners, the Caucasians. But I think this is short term. I don't think this is long term. But the question is a deep one. I mean, around the region, if you have Rohingyas around the region and other migrant workers and so on. In Singapore, certainly this has been very visible. So I think it's a mixed bag. It depends where you look. But the question is spot on. This is part of the social impact, and we need to correct perceptions. And we need more information so that the prejudice and the bigotry, any kind of racism will not will not become entrenched and become long term. This has to do with more information, maybe better handling from the authorities, so that we're not left behind after COVID with undue negative perceptions of our ASEAN neighbors.
From the context of knowing the enemy, sometimes we have this article that was produced also in our ASEAN magazine, that the virus is the enemy and not the person who is sick and ill. Mm-hmm. We have this we have already observed these types of stigmatization and prejudices, not at the regional level, but also at the local community levels, wherein the person who is sick is stigmatized. And sometimes, personally, as a medical doctor, as well as also as clinical practitioner, I have seen this type of attitude wherein nobody wants to be tested, even for a rapid antibody testing, simply because they have this fear of being marked as a source of infection, and as such should be avoided, and as such should at all means should not be with other people, no? In terms of in spite of being cured and being treated and managed very well. So we have seen this already in HIV and AIDS problem, and we are also observing this in terms of the current COVID-19 pandemic. And definitely, this should be addressed in terms of constant communication, risk communication, and also addressing fake news and misinformation, because as what we have learned from previous infectious diseases, particularly our experience in risk communication and information, education, communication, and HIV and AIDS, Similar principles could be applied in addressing misinformation, fake news, as well as lack of information and lack of understanding in addressing COVID-19 related social predicaments or social issues. No, so in addition to that, there are, with regard to the ASEAN health sector context, there are platforms wherein civil society organizations, international NGOs could be engaged with, together with the rest of the officials of the ASEAN health sector designated representatives. Over to you, Professor Johan.
Speaking as a Malaysian, we basically, now have a policy of stopping Rohingyas from coming into Malaysia. So this is also the direct result of a perception that perhaps, refugees, migrant workers, and so on, coming into the country can be a factor causing the COVID-19 situation to worsen. In fact, I've written a paper together with another colleague, an economics colleague, on the whole question of migrant workers in the region. The three countries that have the most number of migrant workers are Thailand, Titinan, you mentioned, about 3 million, 4 million. Singapore, which has about 1.2 million migrant workers. In Malaysia, which has actually something to the tune of about 6 million, include the undocumented migrants. So the perception that's increasingly being noticed is that migrant workers among citizens, migrant workers are the ones that have brought the disease to these countries, or are a factor in causing COVID-19 to expand or to increase. And that, of course, is actually a very false, picture. Well, truth be told, that in the case of Singapore, the cases that are mounting in the 43 or so dormitories, which house the foreign workers, they are the ones that are showing a spike in the numbers. But then if you put them in these very small confined spaces, then the chances of the COVID spreading is very likely, isn't it? So, and the same thing would happen, say, with Malaysia, which have now put, these migrant workers in 3 major facilities. Now, I don't know how many there are. There's not enough information that we're getting about, these migrant workers. But the numbers look very good in Malaysia today, but they don't seem to include, what the numbers are among migrant workers. So I think there are all these kinds of issues that need to be addressed. And it remains a problem of the future. And I think, Titanan, you also mentioned that ASEAN countries themselves are highly dependent on migrant workers helping the economy. They are an important sector of the economy, right? So I think these are the kinds of questions that we need to answer and we need to think about as we move into the next phase of the COVID pandemic.
I just want to say that all these migrant workers which are unskilled are not covered in the economics pillar. So as Dr. Fernando has said, it will be covered under the social cultural pillar. So I would look at this at the individual country level rather than ASEAN broad initiatives to overcome. So it's, to me, how each individual country is handling the migrant worker, how Thailand is doing it, how Malaysia is doing it, and how Singapore is doing it, which is quite different, would be quite different from each other. I'd just like to say that in almost all countries, in the face of the disruption of small businesses, the government has stepped in to help these small businesses. How the government intervenes in each country differs. You can step in terms of sustaining employment, because you do not want the businesses to fold up and for the workers to become unemployed and to increase unemployment, which is already increasing. So some countries have used sort of employment subsidies. If we say that government is mitigating at the expense of taxpayers, fiscal intervention would have to be financed by taxes, some form of taxes. So therefore, any form of fiscal intervention would come from the taxation of the country. That is, to me, unavoidable. If the government intervenes, as in the case of Malaysia, without using taxation, by allowing the workers to eat into their EPF, then there's the trade-off between long-term and short-term. So you use your EPF to maintain yourself in the short term, but in the long term, you may not have enough savings to live on. So that is also not a good solution. It would be difficult for me to say that there's a perfect solution, but the solution that is given out in most countries is to help to sustain small businesses from folding up. And that is important for the workers, at least the way I look at it.
Very much. I think, I noticed that in Malaysia's stimulus package, there is a lot of attention given to SMEs, isn't it? Would you agree with me that there was, in the case of Malaysia?
There is some attention, but I wouldn't say there is a lot of attention.
Not a lot. Okay. Yeah, because it seems to me that somebody pointed out that sorry to talk about Malaysia, but since we know more about Malaysia, the backbone of the Malaysian economy, from one point of view, are the SMEs, because what is it, 80-90% of economic turnover is from the SMEs? Am I wrong?
Yes, you're right, but that's not just true for Malaysia. It's for all ASEAN countries. The backbone of the economy are the SMEs.
Yeah. So it would make sense that if there was anybody that needed, any businesses that needed help, it would be these smaller and medium-sized enterprises rather than the big ones, right?
Yes, you want to keep the enterprises alive. You want to help them to maintain their workers. You want to help the workers to keep their jobs.